Hi guys, this is Matt Bateman from Chiropractic once again, and we're going to go through a condition that we regularly see called tennis elbow. Tennis elbow is actually a repetitive strain injury. It can affect the tendons in the elbow and cause quite a lot of sharp pain. People commonly sort of get it confused with the fact that they think that you have to play tennis, but you don't. It can come from all sorts of things. If we just set you up down there, so for example, what actually happens in the forearm, okay, the muscles that come down the back of the hand through the forearm and then attach into the elbow there, they can just pull at the elbow a little bit too hard, a little bit too frequently, and under a little bit too much strain. So then what happens is just in that spot there and a little bit lower, it can become quite sharp, quite tender. And anything from just simply typing to sort of, trying to undo, just try and use your keys in the lock, or in particular we normally see anything from just lifting a small item with a straight arm, okay? Even the grip strength can sometimes cause pain. So what do we do? Actually in clinic, we use a lot of sort of ultrasound, deep tissue massage, acupuncture. We can sometimes actually look back up to where the nerves that control the forearm they come out of the neck. But one of the key exercises that I give to my patients who suffer from this condition is what we call wrist extensions. Okay, so if we just look from this angle, all right, the way we get our patients to do that is we get them to use a TheraBand. Okay, with the TheraBand, what they do is they sit down, they put their foot on the TheraBand, okay, and they take the TheraBand at its reasonable tension, okay. And what we get them to try and do is just strengthen the muscles on the top of the forearm there. Now, at the start when patients are a little bit tender, one of the things that can happen is even just by lifting up like that, it can cause sharp pain. So what we do to start with is we get our patients to use their other hand, just help them up, and then slowly control the descent. So you lift up with the good hand, and you slowly control the descent with the bad hand. Now this should put minimal to no pain or stress actually in the elbow, but it's still going to train those muscles. Okay, when that starts to feel good or feel even particularly easy, you can either ramp it up just by putting more tension in the TheraBand, or what you can do is actually start going through the positive motion as well. So you lift up and slowly control. Lift up, slowly control. Okay, about sort of three sets of 8 repetitions on that daily. Okay, is a great start to really just try and strengthen up that forearm that attaches into the elbow. And but obviously, if it causes any pain, then please stop. A good way to actually minimize any pain that you feel as well is to ice the elbow. Ice, ice, ice. Put ice onto the elbow, even when you're doing the exercise. Okay, and I'll just cool it right down. All right, take care, guys. Take care, guys. Enjoy, and bye-bye.